it's got to take a mental toll on you too, because you're not all like heartless robots. You want to help the families. I mean, did it come home with you?
Yeah, I was drinking, and I don't drink. I'm not a drinker, but there were, Friday nights. Couldn't wait to get home and have a shot at Tawaka.
Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up. Hey, it's Jordan. I'm delighted to be joined by Jenny. You are a former employee at UnitedHealthcare. You were there about a decade ago, and you did a video that I guess maybe you weren't expecting blew up, but kind of blew up with everything going on with the murder of CEO Brian Thompson by alleged shooter Luigi Mangione. So tell folks first, when did you work there and what did you do for them?
Well, yeah, I did. I worked there about 10 years ago, and I started out in professional services, and over the course of time, I was eventually promoted to a supervisor position.
Mm-hmm. So you were at first dealing with claims, or what were you doing?
I was in provider services. This is when it was MAMSI at the time. It was purchased later by UnitedHealthcare. And so I was answering incoming calls from doctors' offices for various things, whether it was verification of benefits or problems that they were having with claims, and answering questions that doctors' offices would have.
So tell me about the evolution. I'm assuming when you started, you got into it to help people, but fairly quickly you were starting to see the denials, frustrated patients, and listening to, horror stories on the phone.
Yeah, well, in the very, very beginning, I was only talking to doctors' offices. They were still frustrated. But yeah, I didn't talk to patients till later on in my career. And that happened over time. I went in an entry-level position. I had worked at a doctor's office before, so I had to learn over time things about the insurance industry. Didn't necessarily know what I was doing in the beginning, so things started to come to light as I worked there. And
you shared a story in your video, and I'll put the link to your video under this, about a 14-year-old girl, rare, but she was a hermaphrodite, and needed surgery to correct that. Can you kind of share what happened with that?
Yeah, I can. So at that point, while I was working there, my position was called a customer advocate. And the calls would come to me. They would be basically escalated calls. So if you said, I want to speak to a supervisor, you spoke to somebody on my team. We had the same authority as far as what we were allowed to do on the calls as a supervisor, but we didn't have subordinates. Okay. And I got this call. It started out with speaking with the administrator, and we were progressing nowhere really, as far as getting it resolved. And this was one of the rare opportunities that I actually talked to the doctor. And so the situation with this child was born with both body parts. They had male and female body parts. And we had paid for the claim to have her penis removed, but we were denying the portion of the claim to have her vagina rebuilt, or to build a vagina for her. And the reason was it was an exclusion for sex change operation. That was an exclusion at the time. And when I talked to the doctor, he said, I don't care. I'm just going to go ahead and do it. But, the thing about why this story sticks with me is that, in my layman's opinion, and I'm not a doctor, when you have male and female parts, this is not a sex change. This is a correction. There's a medical reason to do this for this person.
Mm-hmm. And also, UnitedHealthcare clearly knows the difference between a voluntary sex change and a hermaphrodite who was born this way. Right. And also, in a lot of cases, the doctor wouldn't have gone ahead with it because doctors, various reasons, don't want to go against the insurance or want to get paid. So if this doctor didn't do that, that delay could have been costly to the child of, rebuilding the female parts.
Yeah. And actually, I guess the reason why this affects me so deeply is because in a way she's already been put at it costly. She's 14 years old. She's gone through puberty.
Right.
That's.
And for a family, when you're dealing with a child who, was born with two reproductive systems and kind of the stigma attached to that, to then have to go, it's obviously a big thing to do the surgery in the first place, but then your healthcare company that you're paying for is denying you for the second part. I mean, that's got to be excruciating for the family, but also, I mean, you seem like, you wanted to help.
Yeah. And there was another issue with this I didn't mention in the other video. There was also a language barrier. I don't know where they came from, but they did not speak English as a first language. And that was in the notes that I was able to access, that there was a language barrier. So.
Yeah. And you don't know what happened with that because a lot of these.
I don't. And that was another thing. Like, I would do the best I can to help these people, but, I wouldn't have had time anyway, but we're not supposed to go back and relook at whatever calls we handled. Just we handle the call, move on to the next one. So I, to this day, don't know what happened to this person.
And there was other instances where people needed MRIs to identify or rule out cancer, but United was denying that as well.
Right. So this was a vicious circle kind of a scenario where, and that example came from a position I had transitionally from the entry level to this customer advocate position, where they called it shelling. We were entering authorizations into the system. There were some things that we were allowed to automatically pre-approve without medical review. And some of the things with MRIs we could pre-approve, but some we couldn't. And we would get denials for claims that were, the diagnosis code was to rule out cancer. And so they would deny it because it wasn't a cancer diagnosis. And so that was the circle. Like, how are you going to diagnose that it's cancer if you don't do the diagnostic procedures? It's
crazy. You need the MRI to find out if it's cancer or not.
Right. Right.
And was this?
It was, but.
And obviously you weren't like at the executive level, but were the justifications for this, as far as you know, like just incompetence or, higher up intentionally creating this system just to deny care? Or is that just unknowable?
I don't really know 100%. I would hear people, on break time or whatever, when we would all kind of come together in this kitchen clutch, and people would be talking about what they were told to do their job. It wasn't my job, so I can't say 100%. Yes, we have to deny so many claims per month to meet our shareholders' expectations, but I do know that people were complaining because, they had to meet a certain amount of claim denials. So
people were telling you that there was a quota for how many denials?
Yep.
Which is kind of like less deadly, but, cops towards the end of the month, you have a quota, how many tickets you have to give out.
Right.
And everybody's different, but when you were talking to employees, were they frustrated with this they had to meet this quota for denials rather than approving what in many cases just should have been approved?
You would get that kind of a feeling, people weren't talking about it in the way that we're talking about it now. And I say in general, the public is talking about it now. They were kind of bitching about their job is really the atmosphere is when it was communicated to me.
But, it's got to be, obviously the focus right now is on American suffering at the hands of these companies, but you're human too. So when you were, for some part of your career there, dealing with patients frustrated on the phone, and you were also talking to others. So it's got to take a mental toll on you too, because you're not all like heartless robots. You want to help the families.
Right.
Can you kind of talk about the toll it took for you when you're dealing with families? Some of them were angry. Some of them were, emotional. I mean, did it come home with you?
Yeah, I was drinking. I mean, well, okay, so I was a smoker before I went there. I was smoking very heavily. Obviously, when we're talking, we're smoking. But yeah, I was drinking. And I don't drink. I'm not a drinker. But there were, Friday nights. Couldn't wait to get home and have a shot of Chewbacca.
So is that because you're just dealing with, mothers on the phone in some cases crying or yelling? What kind of, for you, drove you to that?
It was twofold. There's a lot of pressure in customer service anyway. So, to make your job and do your job right, and having people just yelling at you in general, even if they don't understand what's going on. But then when you're telling somebody something, because we're the news, we're the messengers, right? And you tell somebody something that they don't want to hear, and sometimes you can't help them. Yeah, it takes a toll on you.
Mm-hmm.
And so there's also this expectation that you're the front lines of the company. You're supposed to put on your best face and represent them. And in the back of your mind, or even in the front of your mind, you're thinking something's wrong. How do you do it?
Right. And, obviously you've been gone since about 2013, but you're seeing now all this outrage in the aftermath of the CEO's murder towards the companies. Mm-hmm. And I mean, they're up to like 32% denials. They lead the industry in denials. Now they're using AI to mm-hmm. increase denials. Right. You even have a lot of doctors are doing videos, kind of, mm-hmm. blowing the whistle on them. What are your thoughts? Obviously, you kind of moved around in the company, but do you feel like United was always this bad, or it's progressively seemed to have gotten a lot worse?
I'm not 100% sure on this. It would be easier to say that it got worse, but I'm not 100% sure. It does seem to me like there's this huge conflict of interest with the insurance companies and how they're running their business versus what they're supposed to be doing, and growing the way that they are and accumulating businesses the way that they are. And insurance business is not the same as, say, having a store or like Disneyland or something like that. This is a business where you pay money into it, hoping that you never have to use their services, right? Where if you go and buy a car, you expect to go home with a car that day. Okay, insurance, you pay money in, you hope you don't have to use them, but eventually you're going to have to use them. And then to have to go and say, sorry, it's not covered, or, something like that, that's I think where the biggest indignation is. But to say it's getting worse over time, I think that they're buying up businesses that maybe they shouldn't be, if they're going to, like, I had done a video, it went out last night, about the pharmacy, the PBM Act, and they're telling people, or what they're trying to do is to prevent and to divest the insurance companies who have purchased pharmacies. Mm-hmm. Okay, so that's what I'm saying here, is what I'm trying to say. So if you're buying a pharmacy and you're dispensing medication, but you're also insuring that, there's a conflict there.
Right. Well, there's also reports out that United in specific has been, because they were delaying claims for mm-hmm. so long to providers, the doctors, offices couldn't meet payroll and they were going belly up. And then United swooped in and bought the providers. Mm-hmm. So that would mean United is then paying or not paying themselves if they own the providers.
And in actuality, it wasn't because United came in or any other insurance company came in and bought the practice that I was working for, but that practice actually did, and this is before Obamacare, they filed bankruptcy. And my office was closed. That's how I ended up for Mamsie.
Wow. And, I'd like to play this, actually. I know he wasn't,
Yeah.
He wasn't your direct boss or anything, but this is Andrew Whitty. He's the CEO of United Health Group, which is the parent company.
Right.
He was praising Brian Thompson as some hero of, the healthcare industry. But he said something else, which is, in my view, incredibly tone deaf. Let me play it and get your thoughts.
There was nobody who did more to try and advance that mission than Brian Thompson. And there are very few people in the history of the US healthcare industry who had a bigger positive effect on American healthcare than Brian. And we are going to make sure that we not only acknowledge and honor that legacy of Brian, but we'll continue it. Our role is a critical role, and we make sure that care is safe, appropriate, and is delivered when people need it. And we guard against the pressures that exist for unsafe care or for unnecessary care to be delivered in a way which makes the whole system too complex and ultimately unsustainable.
Love your thoughts, because I don't know. I mean, why are they deeming what's necessary or unnecessary if the doctors who went to school and have the expertise are telling them X treatment or MRI or surgery is necessary? Shouldn't that be the last stop? If the doctor's saying it's necessary, they seem to have reversed that, and they get to decide what's necessary.
Yeah. My experience, I'll just tell you what my experience is. I had to have a hysterectomy, and I was kind of young, and I wasn't that young, but I was kind of young. And thankfully, in my case, mine was not denied, but there were times when I would see other procedures, hysterectomies, but also other types of surgeries like back surgeries and knee surgeries and so on and so forth, where they had to do other things beforehand. Okay. But when I had my surgery, I sat down with my doctor before and we talked about different options. I didn't have to have a hysterectomy, but that's what I chose to do. Okay. So it was a discussion between me and my doctor. And I think a lot of people, a lot of professional people do that before they make the decision of how they're going to treat their patient. But, how do they decide without talking with the patient what kind of prior care leading up to that is appropriate for that procedure, whatever it is that they want to do? It's personal. That's personal. You can't make a decision based on a number, or there's a person involved with that. You have to have a discussion, and that's how you give care.
Yeah, it just seems like, you said conflict of interest. If they're saying, you got a quota for how many denials, obviously, their priority seems to be profit,
right,
rather than ensuring you could cover the most amount of people.
Yeah.
And at the end of the day, he's talking about it with, we safeguard against unnecessary care because it would make the system too complex. Well, the system is very complex. That's part of the problem.
Yeah, it really is. And I have my thoughts on this. Okay. I'm actually thinking about doing a video about this myself. The insurance is complex, okay, because they've made it complex. Healthcare is complex because human beings are complex. We send doctors to school to learn how to handle that and how to do their job, right? That's what we do. We send them, and they're doctors for a reason. But our healthcare here in the United States does not have to be complex. It's not complex in France. It's not complex in Canada. It's not complex in Australia. And those people are listening to my video too, and they're making comments on, they can't believe that we have to go through this to get healthcare.
Right.
It doesn't have to be complex. We're making it complex.
There's another element. Obviously, Americans, all of us have experienced waiting on the phone for 20 minutes, a half hour, 45 minutes to get somebody like you on the phone from UnitedHealthcare. And we're angry, but you shared in your video, in a lot of cases, it's management and higher up basically putting one poor soul there, understaffing. Can you kind of talk about that? Because you had experiences where, I mean, you were getting calls when you were off from, you know, an overworked and stressed out person because that employee was the only person there to answer calls.
Yeah. That was when I was in a supervisor position under Optum, and the number crunchers decided that we only needed 5 people to cover. My team did after hours and weekends. So yes, the call volume was lower. And so, you know, I can see if you just look at the numbers, that would make sense. But if you're looking at the people, so the people who we managed the FSA card, looks like it was MasterCard, right? If you look at the people who are calling in and they're standing at, you know, the pharmacy trying to get their medication and the card's declining for some reason, they're going to call, right? Meanwhile, they're standing in line, they're holding up the line. They look like they didn't pay their bill because the person behind them, all they see is that the card's not going through, right? And then they can't get a hold of somebody. You know, that in itself is frustrating when even if it's something that can be fixed simply. Meanwhile, my person's there. She's got to take her break, so she's off the phone for 15 minutes during her break time. And she comes back and she's got people angry because the queue is filling up. And then she's got to take lunch. Now she's off for 30 minutes and the queue is continuing to fill up. And then she comes back and now, you know, she's got to spend her time de-escalating somebody's emotions on top of trying to help them.
Right.
And it's stressful. I mean, think about it. If you sat for 8 hours in one place, you can't even get up and walk around, and somebody's hollering at you, whether it's justified or not, it's going to wear on you.
Right. But it's not that person's fault. They're just understaffing it. So on the weekends, they're putting one employee to answer, you know, on any given day, dozens of calls.
Yep.
Right. So, which, you know, isn't unique to the healthcare industry. There's plenty of industries in America trying to, you know, do more with less. But in this case, you know, this is people already frustrated or in some cases desperate. And then you're also probably not getting the best customer service because they're so stressed that they can't, you know, respond like they would if it was well staffed.
Actually, I'm so proud to say I had a very good team. I really. And, you know, when you call and you say this, you hear this call may be monitored for quality purposes. You hear that everywhere you call, right? We did that too. And my quality on my team was very high. Usually we had passing. We really didn't have a lot of problems. But that's me. I'm going to take credit for that because I coached my people and I did the best I could to support them. And I had good hires. I really did. I had people who, you know, they genuinely wanted to do their job. But I honestly did have to, you know, talk to somebody because she's cursed under her breath because, you know, she reached a boiling point too.
Right. And, you know, for you, when you're seeing all this outrage at United and other healthcare companies, obviously, you know, I'm not saying condone murder. Murder is not good, but it seems like the healthcare companies' response is to build a higher wall, you know, hire more security and kind of build this fortress around them rather than actually evaluating like, hey, maybe our practices are predatory and we need to change things around. I mean, I'm sure you're not surprised by the response, but what's your thoughts on, you know, Andrew Whitty and the other companies' response to this?
Well, right now they are on high alert. So when you think about what happened to Miss Boston in Florida, that probably wasn't fair. I think I've had people say worse things to me. But I understand why it happened.
Referring to the mother who was arrested for supposedly threatening. Yeah.
Yes. And all she really did was she quoted Luigi and then she said, "You're next," or something like that. She probably shouldn't have said it. Okay. But yes, they're on high alert right now. Understandably so, because if I was still working there, I would be concerned too, you know. But yes, I think that they're not listening to what people are saying. And this is the problem. Like it's been the problem. They're not listening to what people are saying. People like me, people like you, okay, the average person on the street, right? This is my humble opinion. I think they're listening to the dollars. The politicians I'm talking about are listening to the dollars. I think the politicians can fix this, and they're not listening. And the insurance companies aren't listening either. You know, it's still going to be about the bottom line. And
Yeah. You know, that was my next question. I don't care what your politics are, but at the end of the day, you said it. I mean, other countries do not have this system.
right.
But we have a system where there's a flood of money. I mean, United Health Group, their lobbying last year, 2023, was $10 million. I think it's on pace for like 6 or 7 this year. Then you got all the other companies, and then you have Wall Street, which is heavily invested in all these companies. So it's beyond conflict of interest. It's just corruption. I mean, call it what it is.
Right.
So, I mean, yes, be outraged at the healthcare companies, but don't people also need to start looking at the politicians on both sides who are taking this money and then giving us all sorts of rationalizations why we can't fundamentally change the system?
Yeah. And like I said, I'm learning now too. You know, I've been out of this for a while, but I feel like I really need to do something. Okay. So I'm trying to educate myself, and I've been looking at different things, and based on comments that are in the video. And a lot of people have been talking about universal health care, and some people have brought up that we actually have universal health care right now. It's Medicare. So I'm still researching it, but some of the things I've seen about Medicare, it was knocked down for whatever reason. But we actually have a plan in place. We're just not implementing it.
Right.
Yeah.
Absolutely. You know, what's interesting, and I think there's been a lot of propaganda out there by the healthcare companies and their lobbyists, but people think, I don't want government running healthcare. But really, what other countries do, it's just government paying for it. It's not government administering the care. You would still have doctors and hospitals, and you would still need employees like you. There's just a lot less administrative overhead, bureaucracy. So I think there's been a lot of misinformation out there by United and others that it's, you know, government in your doctor's office, when in reality it's government pays the bill.
Right. And you know, I'm not gonna go there. That's too controversial.
You could go wherever you want.
Okay. So we have government in everything we do anyway. When you go into a restaurant and you want to get something to eat, you're hoping that the inspector has come and made sure that that restaurant's clean and safe, etc. So I was a hairdresser. They would come into our salons to make sure that we were abiding by, you know, whatever regulations we had to do. So there's nothing wrong with the government saying, look, you have to maintain this certain standard for public safety and health. Okay. I don't have a problem with that. I think most of us don't. If you think about what you're putting in your mouth, or, you know, is this person actually licensed to perform a surgery on me before they knock me out? You know what I'm saying? That all makes perfect sense. But as far as having a universal health care, it would save tons of money. In the end, it would, even if you had a small increase, and I don't think it would be that great. If we took every single person who pays taxes in our country and took just a little bit more tax money out to pay towards a universal health care, it would still cost us less than paying the premiums. And you would know what you're paying for.
Right.
It really wouldn't change, except maybe if it changed, your income changed. Do you see what I'm saying?
Well, also, I mean, you don't have to be an economist to understand it would be better for the economy too.
Yes, exactly.
If people have more money in their pockets because they're not paying deductibles and copays. I got 2 back surgeries with insurance. I got a $6,000 bill between the two. I still haven't paid it off.
Right.
Well, if I didn't have to pay that, I could go out to dinner. I could go out, you know, maybe a short vacation. You put more money into the economy when people have more money in their pockets.
Right.
So it just seems like, you know, for example, when your deductible restarts at the end of every year, what is that for other than paying the insurance companies to grease up quarterly profits, CEOs, et cetera?
Yeah, your deductible, all you're doing with a deductible, you report to the insurance company that you've had this service and this is how much it cost, but you're not even paying them that money. That goes to the doctor out of your pocket. But there's one other point that I wanted to make about Medicare and Medicaid is that we're already paying for it. You and me, well, I guess we're independent. I pay my own, and you, I don't know how you do, but when I worked for any other employer, I paid 7.5%. The company paid 7.5%. I pay 15% now, so I'm paying into it.
Right.
I'd pay 20.
Right. But also, I mean, at the end of the day, we are being taxed now. It's called co-pays, deductibles, co-insurance, you know.
Yes. Absolutely.
Exactly. And, you know, my last question to you is, you know, you had mentioned, like, you know, this, not that you were drunk or anything, but this drove you to drink. This took a toll. And even now, you know, you were kind of moved on from this, doing something else in your life, but it's in a way triggered you seeing all this. Can you kind of talk about for you, and I'm sure you keep in touch with other people in the industry, you know, emotionally just seeing this, is it kind of what you're emotionally for you seeing this outrage? Has it kind of taken you back to that experience when you were there?
Kind of. I mean, it is a little triggering. I feel like I'm in a different position now because I don't work there. And so I've had some healing, but it is triggering me. It took me a couple of days to even make the initial video to start with. And I'm having anxiety just as I talk to you. Yesterday I was up at 4:00 in the morning, couldn't fall asleep till 3:00. Not yesterday, the day before yesterday. Couldn't fall asleep till 3:00 that night because I'm thinking about the stories that people are telling me. I'm thinking about the doctors who are reaching out to me. I'm thinking about the coworker, or I'll say coworkers, but employees who are reaching out to me. So that's bothering me. And then I'm thinking too about, you know, the people who have no hope. They don't believe that our government's going to take care of us. They don't think they're going to listen, because I had said, you know, maybe we should start writing letters and holding these people in political power accountable. And they're like, it won't make any difference. And that's sad.
And you mentioned there's current employees reaching out. You don't have to share.
Yeah, current employees.
And are they reaching out to you just that this is triggering them and they're?
Yes, they're feeling the same thing I am.
Because they're in it now. They're
they're in it now. And the doctors are in it now. You know?
And those current employees, do they feel like they're kind of a part of a system that's, for lack of a better word, killing people?
Nobody's expressed that as an employee, either currently or formerly. They haven't expressed that. And I don't feel like I killed anybody. That was not where my heart was. But I have had comments that, you know, I have blood on my hands and I'm just as evil because I work there.
Right.
You know, even though I had 3 kids, I was a single mom. I had 3 kids I had to feed and keep a roof over their head.
Right.
You know, and I didn't know everything going in. You learn as you go, right? Right.
So. And most of the people in it at the lower level actually want to approve things and want to help people.
Yeah.
You're not creating the policies for quotas to deny.
Exactly. Yeah. Just
Absolutely.
You know.
And finally, kind of off of what you said about lack of hope, do you see this changing? Do you see this as a wake-up call to the, you know, UnitedHealthcare's, or they're just waiting for it to kind of fall out of the news and they'll pay maybe a little bit more in lobbying and pay some more people off and kind of move on?
Yeah, it's interesting that you say that. I don't see the insurance companies as taking this as a wake-up call. I really don't. I think, yes, things will stay, you know, tense and they'll keep their security up for a while, but they're going to keep on going the way that they're going until they're forced to stop. They're not going to stop until they're forced to stop. And this is where shooting people is not going to be helpful. Okay. It really isn't. Right. But we as a nation need to stand up, and people are telling, oh, well, stop paying for your insurance. Well, sometimes you don't have a choice. You know, if your employer purchased UnitedHealthcare and that's the only choice you've got, you're going to take what you get, right?
Right.
So, you know, boycotting is not going to work in this particular instance. We're really going to have to go after not go after, I gotta watch what I say too, right? We need to approach the government and explain our point of view and tell them, this is what the public feels, not the insurance companies.
Well, I don't think there's anything wrong with going after them politically. Hey, if you're going to keep taking this money from these companies, if you're going to keep taking big money from big pharma and then, voting no on universal health care and, saying then you should expect to lose your position, to have primaries and, other things. So I don't think either of us are calling for violence, but at the end of the day, I think people have reached a breaking point, which is kind of the response we're seeing. So thank you so much. I'm going to put the link to your videos so people could check out your channel.
Thank you.
Obviously, current employees aren't speaking out because they don't want to lose their jobs. So it's valuable to have a former UnitedHealthcare employee speak out. So thanks again.
Thank you.